Today's guest, Ronald Gruner, had a 40-year career as the founder and CEO of 3 technology companies and is the author of his new book, COVID Wars, America's Struggle Over Public Health and Personal Freedom. Welcome to the show.
Well, thank you, first of all, for the invitation. I'm looking forward to today's conversation. As I say in the introduction of the book, I was initially hesitant to write a book about COVID because I began the book in 22, just as COVID was really coming to an end, and we all, I think, were fed up with COVID and wanted to put the pandemic behind us. But I had friends who had enjoyed my first book, and they urged me to think about writing a book about COVID while it was still fresh in people's minds. And as I'm sure you know, there was so much information and disinformation about COVID that perhaps I thought I could contribute something. So I chose to write that book. It's about a 2.5-year project, did a lot of research. And the book really contains 10 pretty basic chapters. It starts with the discovery of the viruses in 1892 and even goes before that to the London plague of 1665 and how that affected people, the Spanish flu in 1918, how that affected people, and how both of those plagues in many respects were similar to the COVID pandemic in 2020. So that was an interesting insight I wanted to share with the readers of this book. Then I kind of go methodically through the pandemic, starting with 2020 and how that developed, how people were confused about what was going on, how we got confusing messages from the federal government, and how disinformation flowed from the left and the right, up and down, and was even further confusing people. That was a major factor in 2020. And then I talk about how the nation divided largely in the end of 2020, with half the nation feeling strongly to reopen as quickly as possible, and the other half being more, let's just say, more cautious and reopening more slowly. And the book evolves from there. It discusses vaccines, the issues concerning vaccines, the doubts concerning vaccines, the misinformation about vaccines, and then a lot of information about how vaccines affected death rates. I'll talk about COVID death rates broadly. I analyze those at the state level, the county level, and the city level. Talk about what we call excess deaths, as I'm sure your listeners know. During the COVID pandemic, many people died of COVID, but hundreds of thousands died of other issues, cardiac issues, cancer, even Alzheimer's disease increased during the COVID pandemic. Discuss that, and I provide statistics on that and what groups of people tended to die from those secondary illnesses, non-COVID illnesses, versus those that did not. Then I discussed the issue of lockdowns, how that affected people both health-wise and socially and economically. And there were some interesting conclusions on that we can discuss later in this discussion. And then I kind of wrap things up discussing a historical perspective, comparing the COVID pandemic, in particular, how the United States responded, both in terms of health-wise, in terms of managing health and deaths, managing the societal impact, and managing the economic impact. I look at all 3 aspects of that, and I compare those with 19 other major developed countries, countries like France and Germany, Australia, and Canada, and how the United States did. And lastly, the last part of the book is the epilogue. And there I talk primarily about the ongoing research and speculation as to the source of the COVID virus. And don't draw conclusions there, but I give some thoughts for the reader to think about, and conclude with a brief discussion of long COVID, what we're still living with. And in many respects, is more difficult to treat than COVID itself because the symptoms and the morbidities, which long COVID is manifesting, are more complex than the original COVID. So that's becoming an issue for people, and hopefully it will be managed in the future. So that's an overview of the book. I've written it in a way, although there's a lot of data in the book and statistics, I've tried to make it as easy of reading as possible. Every chapter is about 45 minutes long. My thinking is after dinner, you could get yourself a glass of wine or a cup of coffee or whatever your pleasure might be. And before you really finish that, you've completed a chapter. And I've included a lot of anecdotes, for example, how viruses were first discovered and what a coronavirus looks like and how a coronavirus works. In layman's, I try to describe it in layman's terms. Like I said, I talk about the London plague of 1665. That's fascinating in the similarities that we have with us. So a lot of background information that isn't directly related to the COVID pandemic, but I think for a curious reader, and I think it probably takes a curious reader to pick up a book on COVID at this point, today. I think it provides them some interesting background other than just a long manifesto about what COVID is and what COVID could have been if we had managed it perhaps better. So that's a rather long-winded summary of the book.
I think that was actually kind of perfect, to be honest with you. One of the things that I really liked about the book, and I read it in those chunks, just like you said, during breaks, lunches, stuff like that. I would take the time and go and read the book. Not something that everybody's looking to read on their lunch break, but I with my background in grocery, as I managed a grocery store during the pandemic, a lot of that stuff really brought me back to that time, and really kind of reminded me of things that in certain ways I kind of maybe even intentionally forgot, because it was a very different time. It was a very chaotic time. But one of the things I really enjoyed about the book, and something that you hit on there, was the way that you use the charts. I think that this society, America as a whole, in my opinion, and possibly this is also something that's seen outside of America, but from my perspective, is we have a real problem with reductivism. And we like to kind of, hear what our pundits tell us or what our favorite politician tells us, and we like to say, that's what happened, or that's what it is. And I think what you did with the charts was really good, because you really tend to present the information in the book as this is what happened, and then you go into statistically how you answer, what the results of that was. So when we talk about the schools closing down, or we talk about the economic impact of COVID and stuff like that, it was very well presented. I'd like to go back to kind of what you were saying at the beginning there, and that is, this all started a long time ago, right?
Well, yes. I mean, viruses, as you know from reading the book, have existed for millennia and have evolved over millennia in both animals and humans. And it's only once in a blue moon that a mutation of a virus becomes really infectious and dangerous to humans. And so the virus that killed so many people in 1918 with the Spanish flu is really a first cousin to the COVID virus. And that had been evolving for 100 years. And after 100 years, and I'll back up just a little bit. And so we had surges of deadly flus in 1957, for example, the Asiatic flu in 1957. People don't remember that, but that killed over 100,000 Americans in 6 months before the vaccines became available, which they actually became available rather quickly. And then we had the first swine flu in the 1970s, and we had SARS in the early 2000s. So we had many versions of viruses and flus, influenzas, that all are derived from very similar viruses. And so the COVID virus that popped up in late 2019 evolved, or some people believe were created, out of viruses that had existed before. And that is indeed true. And unfortunately, they're continuing to evolve. That's what's causing long COVID, among other things, I believe. And we'll see a manifestation of that again, where we get another major pandemic. And hopefully that'll be a century from now, when we'll know very, very quickly and easily how to stop that in its tracks with today's evolving technology. But it's been around for a long time.
Yeah, and we even see right now with what's going on with the avian flu, we're starting to see some of that as it's getting into the cows, and then eventually, if it were to mutate enough, it could end up in human-to-human transaction, right?
That's absolutely true. I mean, these viruses, because, I'm kind of speculating now, because there's so many more animals, birds and bats and animals like that. There's just much more opportunity for virus to evolve in the animal world than the human world. But occasionally a virus mutates that can jump like the swine flu from pigs to people. And so that happens, very, very rarely, but it does happen. And hopefully that won't happen with the avian flu. It'll stay with, chickens and birds, but it could easily evolve and jump to humans. And that's why I think the Biden administration ordered 25 million chickens to be slaughtered, because they want to stop that. By the way, that's common practice. That's been done before, not just with birds, but also with pigs and cows. If you might remember the mad cow disease in Britain, thousands or millions probably of cattle were killed because of that. It was a disaster, but they felt that was the only thing they could do.
Yeah, and just recently, obviously, RFK Jr., the head of the HHS now, had came out and kind of given his opinion, that's not his lane to be in, but to give his opinion that he thought that the avian flu should be allowed to run through the chickens. And a virologist commented on that, saying, doing something like that, first of all, chickens as a whole do not have a gene to fight off the virus. Therefore, you're talking somewhere in the area of a 90% mortality rate.
Mm-hmm.
But also, on top of that, you're giving the virus 5 million chances to continue to mutate, to possibly find its way into other species as well as human beings eventually. So that is that's something that we all should be concerned about. And when we look at the way that pandemics have been handled in the past, that's generally how we tend to evolve our methods a little bit, but that's where we come from. And kind of one of the funny anecdotes in your book that I thought was just like out of this world, something I'd never think of, was talking about how George Bush Jr. had read a book on, I think it was his summer at his ranch or something like that, right?
Yes, that's a very interesting anecdote that, John, very few people remember or knew about, and it gets people's attention. But briefly, George W. Bush, as you say, Jr., president during 2008, was on summer vacation in 2005. He read John Barry's book about the 1918 Spanish flu. And he, like most of us, really hadn't thought at all about the Spanish flu from 1918, and it shocked him. Because in 1918, almost 700,000 Americans died of the Spanish flu in about a period of little bit more than a year. And he related that back to the tragedy of 9/11, where 3,000 Americans died on September 11, 2001. And he thought 3,000 was a horrible disaster, but a pandemic could kill 1 million people. Mm-hmm. And that struck him very strongly. And to his credit, he convinced Congress to allocate $7 billion to be set aside to fight a future pandemic. And they use that money to buy masks, medical equipment, personal protection equipment, things of that nature that would be necessary in a pandemic. Unfortunately, what happened was that we had several swings of smaller versions of the epidemics flow through. We had Ebola in Africa, and to America's credit, we sent the army over there and all kinds of supplies to stop Ebola in Africa, which we did. We had SARS, S-A-R, which popped up in the early 2011, 2012, and the swine flu. And so all those supplies were depleted by 2020 when the COVID pandemic hit. Obama had tried to get the supplies replenished in 2015, 2016, but Congress was very tight. We had, we call the term sequestration, where the budget was frozen. And so they didn't allocate funds. And so when the pandemic hit in 2020, President Trump was correct when he said we largely had an empty shelf. There was nothing on there. No COVID test kits, no masks, no PPE. But George Bush anticipated that, and it's just a shame Congress didn't renew those supplies a year or two before the pandemic actually hit.
Yeah, and as a side note onto that, kind of what we see going on nowadays with all these government cuts going on with these different departments, different third-party places that are getting cut, like USAID and stuff like that. Do you think that potentially we're setting ourselves up for another type of disaster in that area by cutting all these different government programs and stuff? Because like you said, Trump was correct. He did say in 2020, we have nothing. In fact, a lot of the confusion surrounding masks and such, due to the language the government used at that time about whether or not people should use masks at the very beginning, was centered around the fact that they didn't have PPE for the nurses and all those things. So we ended up in a place where we were kind of giving people confusing information as to whether or not they should have the mask because we were concerned people would start hoarding them. So do you think that we're kind of setting ourselves up for potentially another?
Well, as you point out, I started and managed 3 technology companies over 40 years. So I'm also an entrepreneur, and I know that every organization, if it hasn't been looked at in a while, has ample opportunity to be streamlined. So I think going in and looking at reducing costs, I think that's a good idea. I think, though, that what Elon Musk is doing, he's applying high-tech approaches where the whole idea is go in, break it, fix it. I mean, that's a common term in venture capital, where if you got a problem, go in, get it fixed, and if you broke something, fix it and just move on. And so he's applying that to the federal government, which involves, 330 the lives of 330 million people, many of whom are sick, retired, and so you could argue, I think, pretty logically that he's being very reckless about it. We'll have to see how that turns out. But in general, as you know, we have a huge fiscal deficit. We've got to fix that. And it's a shame that we've waited so long to address that. Now we're almost in panic mode to get it addressed. But yeah, I'm worried about it. And, you mentioned RFK Jr. I mentioned RFK Jr. a lot in my book, and the issues and, frankly, the disinformation he spread about vaccines. And I hope all the physicians in NIH and CDC and the organizations he's the head of make a deal with them. They're all doctors. I hope they say to him, look, we won't practice law if you don't practice medicine, okay? and let the doctors be doctors, and he can serve administrative function, but really stay in your lane. Stop offering opinions about, how you treat avian flu with how you treat measles with cod liver oil or whatever it was. Most recently.
Vitamin A,
whatever it was.
Yeah, and just recently, actually, one of the top vaccine specialists just quit and had left with a pretty fiery resignation as well.
And he had, by the way, he had a good reputation.
Yeah,
over the years.
That's
some
kind of
folks
sad.
Had mixed reviews, but he was well respected from everything I've read during my research of the book too.
Yeah. And, as far as what you said about the cutting of the government and stuff, I think we all agree that there's, waste and corruption. And like you said, anything that runs for long enough, as I well know, I've operated inside of multiple different databases to do with cleaning up inventory and margins numbers and stuff like that. And I know what it's like to be inside and see the types of damage that could be done by people that don't maybe know what they're doing when they're trying it out. So, sometimes I think the biggest factor is how you go about it. And as you said, when you're affecting that many people's lives, it's very important that you're doing it in a way that is both beneficial and also very efficient. Yeah. So, I think that kind of segues very well into a little bit of my experience working with the grocery industry during COVID. I think when we first saw COVID happen, we saw people really come together. At the very beginning, within the environment of a grocery store, we had the stay 6 feet apart, wear your mask, and I would say for probably the first 2 weeks, people were very compatible. People were working together, they were helping each other, they were staying the distance. But I'd say it kind of fell apart after the first couple weeks. I know that they said 15 days to flatten the curve and all that stuff. Trump was in charge during that time. Do you think we all know his famous comments in front of Burke's where he said, maybe we can get the disinfectant inside, maybe we can, use UV light, a strong UV light. Do you think that Trump led to some of that chaos because of his narcissism, his ego of wanting to be to come out of his presidency looking well? Or do you think that how do you feel he did with that pandemic?
Well, I think the only conclusion you can come to looking at the results is he did poorly in most respects. But while I say that, I want to give him full credit for Operation Warp Speed. He announced Operation Warp Speed in May of 2020, and he took a huge political risk. Mm-hmm. I mean, he went on television and he says, "I am authorizing X companies XYZ and paying them." He didn't use the word generously, but paying them to develop this vaccine and to have it available and tested by the end of the year. I mean, that was a huge commitment to the American people, and it was a risk he didn't have to take. So I have great respect for him for doing that, and it was successful. But other than that, he was not a strong leader during a national emergency for a lot of reasons. His personality, he tends to think out loud. So if you look back, and I've watched that video of injecting bleach and the ultraviolet several times, and basically Fauci said, I forget which one, common bleach kills the virus. And you could see President Trump's eyes light up saying, holy smoke, this virus can be killed by something as simple as a bleach. I mean, he was amazed by that. And I think many people were. And then he kind of thought to himself, well, maybe that's some way we can inject it in people. And he kind of thought to himself, and people picked up on that. So I felt he was his own worst enemy. And I've said this about other officials, including Dr. Fauci and Dorothy Bix. Okay, I think what we should have done is we should have appointed spokespeople that were consistent, that had strong public relations training. I mean, if you and I are both in business, and if you have a major disaster of some kind, you want to manage it well. You want to be honest, but you want to manage it, and you want to be consistent, and you want to be clear. And it takes some training to do that. And so whoever they might have picked, I think, should have been a strong spokesman that knew how to communicate with a public that was scared and confused. And we didn't have that. We just sent crazy mixed messages. And of course, that was exacerbated by media coming from every which direction: cable news, social media, printed media, and of course the government and the NIH and everywhere. So there was just a huge amount of confusion. And that's why people tended to kind of fall back on confirmation bias. They formed an opinion, and then they began early on to look for sources that reinforced that opinion, and it got stronger and stronger, and it just fed on itself.
Yeah, and people like RFK Jr. obviously took advantage of that. And I wouldn't even say that, he disbelieves the things that he wrote in his books. I'm one of these people that believe that these people, when they write these books, like the real Anthony Fauci, I genuinely believe that RFK Jr. believes the things he does about vaccines and stuff. And I think that the people that follow him, that got interested in that during that time, I keep saying this because of the environment I worked in was a health food environment. I watched the flip of left-wing liberal hippies become MAGA. I watched the anti-vax, anti-big government, anti-pharmaceutical left-wing hippies that used to attend gay pride parades, and really Trump was their nemesis at that point. I watched them change and become Trump supporters, and that was because they found in Trump, and as you said, you have to give him credit for the Operation Warp Speed. It was fantastic. I was at that time not a fan of anything Trump was doing as far as his leadership values went and the way that he was disseminating information. And so when I heard about Operation Warp Speed, I knew that as a frontline employee, I was going to be one of the first people to be allowed to take the vaccine. That was very important to me because I have 2 young children and a wife, and I wanted to make sure that the vaccine was going to be safe for them to take as well. So I spent hours. During that time, I was doing every job in the building, right? So I would spend a lot of time in this small room packaging products that we would do for private label stuff. And I would just listen to just like everything I possibly could on mRNA vaccines, on the soldier that was in charge of the Operation Warp Speed, as far as like getting it out, and the scientists that were involved in it. I was checking out all those guys. And by the end of it, I had to ask myself the question, am I that biased against Donald Trump that I would not take the vaccine and then potentially, get myself infected or my loved ones infected? Or do I trust in the information that I went out, sought, and found? And I really felt like, this all seems to make sense. It seems to have a history, the mRNA history as far as like science went and how they had researched it. I said, okay, it's different, but it's something that I can get behind, and I ended up taking it. But what we ended up with, as you said, was we watched a flip for the Trump supporters, from him being up there and saying, everybody should take this vaccine. It's amazing. We've really pushed hard. We've accomplished this enormous task during this really difficult time, to going to now there's no more mask. I don't want to wear a mask. And even today, would you say that people seem more hesitant on his side of the aisle to take the vaccine?
Oh, absolutely. I can elaborate a bit on that. I mean, I'm basically an engineer, an entrepreneur by start of my life, and I can think of myself as an engineer. And so, our mantra is data drives out speculation. So I tried hard to really understand and do analysis of what contributed to the COVID death rates. And I looked at it at the state, the county, and even the city level. And I used CDC data. And, you know, a lot of people are suspicious of the CDC and government data. And I point out in my book, and to people like you that I talk to, I said, the CDC data is based on state data. And the state data is based on your county health bureau data. And there's over 3,000 in the United States. And you can go on the web or you can call up the county health bureau and confirm death rates for COVID, for example. How many death rates were in Collier County, Florida during April of 2021? And that data is available. And then you can compare that with the CDC data. And I did that for 12 counties around the country. I got bored doing it. I could have done more, but there was no inconsistency. That data was accurate. So I thought I had a solid database. And then I looked at that data by county primarily, and I looked at a lot of factors: the health rating of the rating of the health services in the state, the obesity level within the county, the education and income level within the county, education level. What was most discouraging to me was a factor that correlated most closely with vaccination rates and death rates. Wasn't any of those factors. It was political orientation.
Yeah.
How you believe politically was a large factor, the largest factor I could find, more important than obesity or median age or the relative efficiency of your health services in your state. It was political orientation that affected that. And to give you an example, I give an example of two counties in Texas, one Midland County and one Travis County. I also compare Vermont County, Chittenden County. So the long and short of it is Midland County, Texas, and Travis County, Texas, are a couple hundred miles apart. They're in Texas. They share the same health system. Many, many, many similarities. What's the big difference? Midland County is strongly Republican, voted 75% for Trump in 2020. Travis County is the home county of Austin, Texas, the capital of Texas. And surprisingly to many people, it's highly Democratic. It's about 70% Democratic. So big difference, Republican, Democrat. Which county had by far the highest death rates? Travis County, the Republican county. I beg your pardon, Midland County had the highest death rates. Travis had the lowest, the Democratic county. And I saw that time and time again, had vaccination rates and death rates varied by political affiliation, unfortunately.
Yeah.
Politics divided us during the pandemic. It was a shame. If politics had not have divided us, many, many more Americans would be living today.
Yeah. And, you know, I think that's obviously it's been the political game for a long time to continue to divide the populace and set these clear lines of you're either on this team or you're on that team. But I think that Trump has definitely magnified that in a way because of his background. I always point out to people when we talk about where we are today and how we got here, how Trump as a whole tends to be an entertainment president, a guy who understands the WWE style of getting people to love one person and hate the other. And, you know, for him, largely it's been successful, but unfortunately, I think for the populace, we've taken the short end of the stick in that area. And for those people out there that are, you know, Republican that chose not to take the vaccine, that, as you said, you know, you have these higher rates of death in those areas. It really is sad to know that rather than to do what I did and say to yourself, okay, I have a political bias against this man. Should I not take this vaccine because I dislike his politics, or should I look to the science to determine whether or not it's safe? I think that if we had more of that in our society, like, we would have had a lot less deaths. And one of the things that I think RFK brings it up in his books, and you definitely bring up in yours, is the instance of myocarditis. Could you go into that a little bit?
Yes, I will. I want to just make a comment about people being confused how to make a decision. And what I'm saying to people now and what they should do in the future is if you have a question, a medical question, you can't decide what to do, and you don't trust the government, the first place to go is to your personal physician. Get his or her advice. And the next place I'd go is I would recognize that we're fortunate in the United States. We have some of the best medical institutions in the world. We have the Mayo Clinic in Minnesota. We have Massachusetts General in Boston. We have Stanford in San Francisco. We have the Cleveland Clinic. We have half a dozen great hospitals in Texas, all over the country. Go to their websites and see what they say, because they
Yeah.
all had information. They all offered opinions about vaccines, masks, social distancing, and believe them, they don't have an axe to grind. And if you go to 4 or 5 of the top hospitals in the United States, which is where you go if you got really sick and got cancer, you wouldn't go to some social media site and get cancer advice. At least most people don't.
Some
Some
people
do, I
will.
know. Some do. Unfortunately, it's a tragedy. But that's my advice. Now, myocarditis, yes, COVID and vaccines have a connection with myocarditis and other aspects with the heart and the body. Uh, but there's a pretty detailed analysis in my book about myocarditis deaths for basically young males under 24 years old. In 2020, before vaccines were available, the the rate of myocarditis deaths for young men uh, increased over the expected level by about, as I recall, about 75 deaths more than expected. I don't have the exact numbers on the top of my head, but what I would do consistently, John, in trying to understand death rates is I would analyze death rates over the prior 10 years, from 2009 to 2019, and then do an extrapolation on that. Sometimes that would be a straight, most of the time that's a straight line extrapolation. Death rates grew evenly, okay,
Hmm.
over time. So you can estimate very accurately what the death rates would be in 2020. In 2020, myocarditis death rates jumped a couple hundred higher than expected before vaccines. Then when the vaccines came out in 2021, myocarditis death rates actually decreased, but there still were deaths from young men, and some, and I estimated in my book, a few dozen in the whole United States that died because they took the vaccine. It did
Mm.
kill a few people, no question about it. But like I say in the book, um, there's a lot of data in the book, so I'm trying to recall accurately. Uh, Now I'm not going to give you the numbers because I can't recall them exactly. But
Hmm.
far more people were saved by taking vaccines than died because of counter reactions to vaccines. It was those counter reactions that were so publicized. And I have to point out and give the example in my book. Many middle-aged and older men take baby-sized aspirin every
Hmm.
day because it's a blood thinner and tends to reduce the risk of strokes. But statistically, that's fairly dangerous. And statistically, taking a baby aspirin, 80 milligram aspirin every day, puts you at the same level of a death as a working fireman, which is a
Mm.
relatively dangerous job. Most people would say firemen are brave and they have a dangerous job. Well, you're at the same level if you're taking that aspirin every day, but we accept that because it does save thousands and thousands of lives due to strokes.
Mm.
And so there's always risks associated with medicine, and those risks with the vaccines got blown way, way out of proportion, uh, which was unfortunate. It scared many, many people off.
Yeah, and the reason I bring that up is because that is such a focal point for a lot of the disinformation. I mean, obviously, our biggest podcaster, or second biggest podcaster, I guess, now in the world, Joe Rogan, pretty much harped on that pretty consistently. And by the way, during that period, I was listening to Dr. Rhonda Patrick, who is one of his guests, and she talked a lot about getting out and vitamin D deficiencies and all these other things, and just to show that you can hear both sides of the story, and then, like you said, search out institutions to verify the information that they're getting, so that way you get the best information possible. And I think that kind of refers a little bit to what Aristotle called the death of aristocracy, right? The idea that we no longer go to our experts for this type of information anymore, that we instead tend to go to who we like or who is popular. And when you have somebody like Joe Rogan who goes and says there's all these young men that are passing away from myocarditis, and you don't go and check that information as you did, you tend to start to, like you said, confirm a bias. And instead of making an informed decision on whether or not the vaccine is safe or not, instead you're taking this popular opinion from a popular person and then choosing to potentially put your own family at risk over that. And I really like that part of the book because I myself had already known that, because even with hearing the information from Rogan that this supposedly was happening, I wanted to go and make sure that he was correct about it. And I found in the numbers that it didn't exactly work out, that myocarditis was this gigantic reason for people to avoid the vaccine. Also, of course, the fact that the coronavirus by itself causes myocarditis. And obviously that's why the vaccine in turn was causing that. So I want to go into since we're talking Joe Rogan, a lot of the conspiracy theories around COVID were some of the strangest things I had ever heard in my life. And I've heard a lot. Like I said, on my YouTube channel, we go into this stuff. I had heard about women's uteruses falling out. That was probably one of the craziest ones.
That one I didn't get that. I didn't hear that.
Oh, you didn't get that one. You got to check out the Reawakening tour. That's where a lot of these really far right people go, and kind of like it's like a Turning Point USA kind of thing. But it's definitely much more conspiracy heavy. But there was a woman who claimed that, yes, that women's uteruses were falling out because of the vaccine. And also the one, I think you actually mentioned this one, the 5G conspiracy as well. What would you think is like, what are some of the crazier conspiracies you had heard about it?
Well, you've named a few. They were crazy ones. The first one that came out was in May of 2020. And that was a video called Plandemic. A play on the words planned pandemic.
Yep.
So the whole video was claimed that basically Bill Gates and maybe Dr. Fauci and the World Health WEF, the World Health Fund, World Health Fund in Switzerland, all in cahoots planning a global pandemic to either sell more vaccines and make billions of dollars, or kill people to reduce the environmental impact of population growth. And that was the Plandemic one that came out, and that went through 4 iterations. And the last one, to give you an idea how ridiculous it was, the last one was a musical called Plandemic the Musical, which had people dancing and singing, pulling off the masks. And I think the whole thing was a huge pun. But the people actually claimed that Klaus Schwab, who was head of the WEF, was behind the pandemic, and they had planned it for years, and many people believed that, which was a shame. Of course, you mentioned that then there were a lot of kind of secondary conspiracy theories, the 5G and microprocessor, the idea that the vaccine contained tiny microchips, which were tracked by the 5G cellular towers, which were just coming in at that time. And so that was a way of tracking humankind, was an example. And then there was that woman in Ohio who claimed the vaccines magnetized you. And, if you stuck a spoon on your forehead, it would stick. The interesting thing is very little silverware is actually ferrous. It doesn't stick to magnets, okay? They're not magnetic. But all this stuff just circulated around, and people just seemed to enjoy it. Now, I have to say, I have a deep bias. My wife is a nurse. My mother was a nurse. My daughter's a nurse. I have 3 sister-in-laws that are nurses. And I personally spent a fair amount of time in the Mayo Clinic in Minnesota. So I have deep respect for the medical profession. And when COVID was happening, my wife was not working at the time. She was retired, but she still had many friends, dozens of friends that were working nurses at the Massachusetts General Hospital in Boston who went through COVID and the issues and the lack of supplies. And so we were hearing from them directly, kind of frontline warriors, about what was going on. And that was very believable. And that's why I say to people now, go to the top medical institutions and listen to them. A book I recommend, which I closed my book with, you might recall, was a book written by a nurse from Boston. I can't name the hospital, but it's a prominent Boston hospital. And her name is Ashley Ann, and the name of the book is All We Had. And she published that about a year ago, and it's the life of a young woman who was a COVID ICU nurse during the pandemic, the very worst time of the pandemic, as well as a young woman trying to live a somewhat normal life, living in Boston during the pandemic. And it's a very good book, and the close to me is very moving, if you might remember that. And I do book readings. I do not read that close because I find it too emotional. About what it was like walking into a COVID ICU unit as an ICU nurse, knowing people were dying and there was nothing that could be done about it. Great respect for nurses and the medical profession in that regard.
Yeah, and that kind of brings to mind 2 things, and that is, one, obviously, people specifically, you point this out in your book. It's not specific to this time period. It's actually something that is actually quite cyclical about humanity, and it's that if you're not affected by something, generally you tend to reduce it. And I myself, at the very beginning of the pandemic, my sister-in-law was one of the first big cases to get COVID before the vaccine, and she ended up on a ventilator. So as many of those people did, she had a co-infection of, I believe, pneumonia or influenza. I can't remember which one. And she had poor health. She was immunocompromised. And this was before the vaccine. And she ended up on a ventilator for, I want to say, 6 weeks to 2 months. Now, when she woke up out of the medically induced coma, she has long COVID. She has been dealing with that for the entire time since COVID. She, at one point or another, had to walk around with an oxygen tank. She was unable to walk long distances. But even just, the being in the medically induced coma caused so many problems for her later in life, because at those times they had no idea what they were dealing with or how to fix it. And I can only imagine what it's like to be a nurse or a doctor in a position where you're dealing with something like this, and you're trying to, do the best you possibly can. Because I myself believe that doctors are trying as hard as they can. I myself believe that nurses and, like you said, your personal physician aren't out to get you and are not trying to just profit off of your health. So when I hear about what you're saying, and yes, I do remember that passage, and it is very emotional to read. It also reminds me of a time I was talking to a lady that was old enough to remember the polio outbreaks, and she was saying she remembered being a child, and she had been in the hospital for something different, but she remembered all the people crying and all the nurses crying, and just like how crazy it was to be in a ward where these people had this disease that no one knew what they were supposed to do about it. And obviously you can contrast the way the vaccine was received in the days of the polio vaccine and how the vaccine was received in the days of this pandemic. And you can really see where we've had like a lessening of our ability to research things well. And also as you pointed out in the 50s in your book, with Eisenhower, and I believe it was the Asian flu, correct? The 50s?
That's correct. Yes.
Yeah,
57 Asian
so how
flu.
that was received as well, and how people had bonded. And obviously the political rifts that have caused that is where we're at today. What do you think? What do you think is the answer? And I know this isn't your job, but you wrote a book, so I'm going to ask you. What do you think is the answer to getting people back on track to trusting the institutions and looking out for people other than themselves?
Well, it's going to take a long time, John. You might recall a chart in my book that shows trust in the government to make the right decision all or most of the time. And that peaked in 1964, just as the Vietnam War was really coming to a head. Peaked in 64, and it's taken a steady decline through the Vietnam War, Watergate, stagflation in the 70s, the Mideast wars. And so today it's at an all-time low. It's been declining now for over 60 years. So it's going to take a long time for people to restore the kind of, we'll never get back to the 65% to what it was, 70%, some very large percentage. But imagine that 70% of Americans thought the government did the right thing all or most of the time back in the 50s and 60s. And of course, it's not too surprising. I mean, we had gone through World War II. We had won that. We had been magnanimous to Germany and Japan, treated them well. They became our greatest allies. We came up with these miracle drugs like penicillin and the polio vaccine. We were fighting the communists, so to speak, in the world. So it's going to be a long time. I think the government it's on the government's shoulders to do that. All those declines in trust almost are not due to the citizens, it's due to the government. Mistakes the government made and the information, the lies they told. Watergate, for example, that took a steep decline after that. So the government's going to have to be more honest with people and more honest with themselves and be leaders and stop being politicians.
Yeah.
I mean, you're responsible for the people and the nation. Forget the best thing we could do is to get term limits in place so people can make decisions on their own and say, I'm going to be out of here in 2 years. I'm going to make the best decision I can. I don't care about getting elected because I can't.
Yeah.
I mean, we should do that as a nation. Get term limits in place.
I think that media literacy is a huge part of that. I think specifically as a person that operates on YouTube, as a content creator, I understand the benefit of clickbait and getting people emotional and hyped up. And I think that that's a huge problem in our society. I think that I say this to my viewers all the time. I say I can put out a video right now about something very important, and I can say honestly what it is in the title, and not a single one of you will click it. But I can put out a video that says that Joe Rogan said Donald Trump wore a diaper on his podcast, and I will get 200,000 views easy.
John, you just hit the nail on the head about social media. I have a small Substack in the hundreds, not the 25,000.
Mm-hmm.
I started a few months ago. And, when I started, I said free and always will be. I'm not going to have paid subscribers. This is just a way for me to communicate with my readers and friends and acquaintances. I put it out every Tuesday morning. The next one's coming out tomorrow morning, once a week. But heck, I check those statistics and see what people like, and it's very tempting to try to tell people what they want to hear, and particularly if your livelihood depends on that. And for many people, they were making their livings off those podcasts and things. So that's dangerous. And back when I was coming of age in the '60s, for example. You only had 3 major networks, and they ran the news operations at a loss. Mm-hmm. Okay, they ran at a loss, but they were trustworthy, and they basically, they maybe had a slight liberal bias, and they were always accused of that. But I don't ever remember somebody saying, those guys did not tell the truth. They gave the wrong facts. They gave the wrong facts, but they might have flavored it a bit. Mm-hmm. But now we get just the wrong facts because, like you say, if you want somebody to click that link and listen to your podcast, you got to get them to click. You got to be provocative, and sometimes people get carried away. And that was a big problem with COVID, and it still is.
Yeah, because the more interesting thing isn't to take the vaccine and to help each other. The more interesting thing is to believe in the conspiracy. And I say this a lot to my subscribers, and that is that we've devolved our society into a 9-to-5, get up, go to work, come home, whatever entertainment that you choose, whether it's social media or Netflix or whatever it is, you ingest that for a few hours, you go to sleep, you wake up, and you do it over and over and over again. And we tend to lack the purpose that, like when you talk about the 50s and 60s, you lack the purpose that those people had during those times because they approached life in a different way because they had more adversity to deal with on a day-to-day basis. And I think here in America, we have an issue with entitlement, which is really good. It's great that we have done so well. We've moved forward so far that people are more and more nowadays being able to find comfort in entertainment or doing other things, but it really leaves a lack of purpose in our lives. And I think that the reason that conspiracy theories have become so popular is because it adds purpose. It gives you something to believe. It's the movie with the most explosions is the most entertaining. It's not the one where it has a really good moral to it. Like, those are the movies I like. I used to say to people, have you ever watched the movie Arrival?
Yes, I have. Yeah.
Yeah. So every time I ask somebody if they like the movie Arrival, they go, "Oh, it was a terrible sci-fi movie." And I go, "Wasn't a sci-fi movie though. It wasn't meant to be a sci-fi movie. It's about pro-life versus pro-choice." Yeah. At the beginning of the movie, the woman sees, or it flashes forward to the woman's child dying, and then by spoiler alert, by the end of the movie, you find that the aliens had given her the foresight to see that her daughter would pass away from cancer when she was 18. So the question was, if you knew that your child was going to pass away in this potentially very devastating way, but you still got 18 years of life with her, would you still make that decision? And so many people miss that. Almost everybody I ask, they go, terrible movie, horrible sci-fi movie. Even Neil deGrasse Tyson.
I didn't see that. I had that confused with another sci-fi movie where the aliens were in liquid, and they would learn to communicate with the aliens. Forget the name of that.
No,
That came
that's
about.
Arrival. Yep, that's it. The one
Is
where
that
they
Arrival?
they draw on the walls.
Yes,
That's what I was
yes.
gonna say. Is Neil deGrasse Tyson actually didn't get it either. He has a critique of that movie where he goes, "Well, let me tell you first of all, you don't bring in a mathematician and this other person to deal with language." And I'm like, I'm screaming at my screen. I'm like, you don't get it. And the reason I know that is because my wife, this drives her crazy. I sit down after movies and I sit there and I think. And I'm like, well, hold on. What was that about, though? Because all movies, all books, as you can see, I love books. Uh, every story has a deeper meaning to it than you see on the surface. There's a reason. Like there's a reason you wrote your book. There's a reason that somebody goes when Ron Chernow writes a biography about George Washington. He's not just doing it because he thinks, oh, George Washington, people like George Washington, so I'll write the book. He has a deeper reasoning. When I just interviewed Jeffrey Boutwell the other day on his ancestor, George Boutwell, and I asked him, how did you come across the idea to write this book? And he goes, well, I was going through some papers and I found this letter, and then I realized, oh, like this was this person that founded the Republican Party back when U.S. Grant and Abraham Lincoln. And he goes, and I just realized, man, here's this person that no one knows about that did all these amazing things. And he goes, so there you go. It wasn't about writing about George Boutwell. It was about the journey of researching and finding these things out. And, my point being, as a long point, but my point being is that oftentimes people don't want to think. They just want to be spoon-fed. They want to be
Right.
given the purpose. And that's a lot easier when you have a shepherd that continually feeds you these things. And I think that unfortunately for America right now, where we're at, is that Donald Trump is more than happy to be the shepherd and more than happy to continue that. And I think when I was asking you what we should do as far as like, how do we get out of that idea of ingesting conspiracy theory versus going to the Cleveland Clinic site and looking it up, is that media literacy really depends on what you want to accomplish. What is the purpose of your research? And if it's just to be entertained, then obviously you're going to find yourself in the hands of somebody like Donald Trump or RFK Jr. And if the idea is to make things better and to become a better society, then you're going to need to look towards the experts and those people. Do you think
That's
you agree
true,
with
and I
that?
think our schools could help improve that. I mean, a lot of the basic skills we learned in school. Me, I'm older than you. First of all, we had a good civics education. I think I spent at least a semester, maybe a year, in civics, learning about the government. In junior high, and a very good U.S. history and even European history. So we had a lot of history. We also had, and I forget where this was, in algebra or trigonometry, critical thinking skills,
Yeah.
or maybe that was in English, where we learned about the common fallacies. How often do you hear the phrase hasty generalization? Not much anymore.
Nope.
But we learned that when I was a kid. And so the whole idea is you can't take one or two instances and generalize that to be the common situation. That's a common fallacy that goes back to Plato, hasty generalization. And, the idea where there's smoke, there's fire. Well, that's BS, okay? But so many people go by these things. They've lost their critical thinking skills, which are just, we're through so much of that so quickly if you just have some of that.
Yeah.
I gave my daughters a deck of cards. It's around here somewhere. Anyway, it's a deck of 52 cards that shows the 52 common fallacies, that you can go through and study those. And all my daughters and friends have that. And so critical thinking is very important. And we've fallen prey to so many of these conspiracy theories and lack of valid information, because I don't mean this negatively. I just think we haven't learned critical thinking skills. And it's not obvious. People think, well, thinking critically and knowing how to think is obvious. We know how to do that. But no, there's a lot of traps you can fall into inadvertently if you don't know how to sort the wheat from the chaff sometimes. And the great Greek philosophers spent lifetimes studying and thinking about that, and they documented that. So that's worth going back to.
Yeah, the idea of mandatory moments of silence, like that's I was just actually reading or listening to somebody talk about Schopenhauer and Nietzsche, which sure, Nietzsche had some some different ideas. And as I tell everybody, I go, there's no person on earth that I've ever agreed with 100%.
Yeah.
I love Einstein. Love reading about Einstein, but there's tons of stuff within Einstein's ideas, his ideology, that I would disagree with. But there's a lot of things that he said and he did that were great. One of the people, I once had an employee where she said, "You seem to always wear the same clothes to work all the time." And I go, "I do." And she goes, "Well, why? Aren't you interested in fashion?" And I go, "I have other things to think about." I go, "You know where I got that from?" I go, "It was Mark Zuckerberg." Somebody asked him once, "Why do you wear the same T-shirt and jeans to work every day?" And he
But I
said,
think you're talking about Steve Jobs.
"Oh, was it Steve Jobs?"
Yeah, Steve Jobs. He was the one, jeans and a black turtleneck or a black
Uh-huh.
T-shirt.
And he said every day I wake up, I have better things to think about than what I'm
Right.
going to wear. And at that time, that person said, and I used Mark Zuckerberg, and she said, "Oh, I can't stand Mark Zuckerberg." And I go, "Well, that has no bearing on whether or not what he said was true." I go, "I'm not a fan either, but at the end of the day, what he said was true, and that is
Hmm.
for me when I wake up in the morning, and that's the point. I think the idea that you can hold two ideas, both I don't enjoy this person's ideology and these certain things, but also at the same time they say something that is true, and I can use those two thoughts to say to myself, even though I disagree with this person personally, I can also agree that they say that something is true, is
Yeah,
something that
that
we
is so
don't do
true.
anymore.
I, I live I have a home. I'm in Massachusetts right now. That's where I got my cold. I'm coughing from, and but also have a home in Naples, Florida. And so I've kind of got the two extremes. Naples and Florida is a very red conservative state,
Yep.
and Massachusetts is just the opposite. And that to me is kind of the best of both worlds. But I mean, I have acquaintances, and I don't want to pick on in Florida in particular, but absolutely refuse to read the New York Times.
Mm-hmm.
Now, I know the New York Times is liberal. I understand
Mm-hmm.
that. Uh, but it has some very good information in it too. And if you can kind of sort the wheat from the chaff in your mind, it's still a very useful thing to read. And likewise with the Wall Street Journal, which tends to be center right. When people ask me, if you want to be a well-informed American, I say, well, to me, I would just read two news. I mean, if you call them about newspapers now, I'd read two newspapers: the New York Times and the Wall Street Journal. The New York Times is center left. The Wall
Mm-hmm.
Street Journal is center right. Read both, and I think you'll get a relatively balanced view. I mean, don't restrict yourself totally to that, but do that. But I know people that refuse to even touch the New York Times. And I'm sure that people that feel the same way about the Wall Street Journal or maybe some of other Rupert Murdoch's news sources, which we'll leave unnamed at this point.
I think that yes, the way that we're gonna find our way out of this current situation we're in is by people learning more media literacy and people just discovering that they need to have their own self. They need to recognize that both the self and the community is really important, but to take care of the community, you have to first take care of the self.
Yeah.
So if you concentrate too much on attempting to get all these ideas and the bias from these people that you follow, then that's all you're going to feed to other people as well. So I love that you talked about the philosophers too, because I think that everything that we build off of needs to be built off of our foundation of philosophy. What would you say was the most interesting thing you figured out during writing this book?
Oh, that's a interesting question. I haven't been asked a question particularly exactly like that. The chapter I found most interesting to write, perhaps answers your question, most interesting to write was the chapter I call Alternative Facts.
Hmm.
And that's about all the conspiracy theories. And so I open it up talking about conspiracy theories historically and how they've evolved even during the London Plague and during the Spanish flu. And then I go through 3 or 4 of the major conspiracy theories during the COVID pandemic and discuss those and their origins. And when necessary, discount them or talk about what was right and what was wrong about them. And then I talk about the whole notion of how we have so much disinformation in the world. And it used to be one of my favorite quotes in the whole book is I quote, use the famous quote, everybody's entitled to their opinion, but not their own facts.
Mm-hmm.
But the other quote I like was in the old days, a hard-nosed newspaper editor talking to his cub reporter saying, You think your mother loves you? Go check it out. So the idea there is validate every fact.
Yeah.
In the old days, in newspapers and uh, classic broadcast television, facts mattered and sources mattered. And I mean, you get fired as a reporter if you wrote a story. I can remember people that made up facts or made up even quotes. Okay, they got fired. So that was very important. And so I kind of end that chapter talking about how we've moved away from that, and we've got to get back where we base the right information that's based on facts, and we do due diligence to confirm that what we're writing about is true. I mean, in my book, I overdo it a bit, but that book has something like 460 sources on it.
Yeah.
In it, okay? And the bibliography, which is so large, it's online. The good news is you have to go online to get it, but that's the bad news. The good news is all you have to do is click on a link and it takes you there, okay? As opposed to having a piece of paper and trying to figure out how to go to it, because nowadays everything's online. But and the other thing I try to do is, I'll let you say whether I was successful in that. I don't believe I ever offered my opinion in that book.
Yeah, and actually, I was just saying this to my wife about the book, was what I really enjoy is the way that you lay out the question, because you start by saying, this is something that is believed. It's not this thing that this person believes is wrong and this is why. It is, this is something. Let's take the educational portion and how whether or not it harms students to close down schools. It is believed that due to COVID and closing, that open states did this and closed states did this. But it doesn't say either one of those had done anything wrong. It just says, this is what they did. This is what Alabama did. This is what California did. And then you present the statistics to show, like, this percentage of people were affected in this way. Now, how does that make you feel? There's sometimes I didn't know what your decision at the end of the question was going to be. I was halfway through it trying to make my own decision as to what I thought you were going to say. And then by the end, your summarization, your conclusion actually surprised me, but not in a way that I disagreed with, but instead in the way that you went about presenting the information. So no, I thought it was actually very, nothing can be completely unbiased, right? But I thought that it presented itself in a way that made me feel as though I was getting information rather than being fed a conclusion.
Well, that's sincerely what I tried to do. I tried how to do that. And, my motto for that was a legal brief. Having been in business, I had been involved in legal issues, and I had some good attorneys. By the way, we never filed. We were. I won't go into that, but it was all civil stuff, and it all worked out well, I think, for all parties. But I had several attorneys that would write a legal brief. I told them that this is like a symphony. The way you evolve this legal brief, the way you open it, the way you build your case, the way you build your conclusion, it's like a symphony. And that was the model I had when I talked about, for example, lockdowns, and I present the idea of lockdown. Some states did, some states didn't. What were the factors that may have been affected? COVID death rates, societal disruption, economic disruption. And then I try to present the data as slowly and clearly as possible, and then ideally let the reader come to the conclusion themselves without coercion. That's what I tried to do. That's what we did. We tried to, at least.
And I think that if we want to get out of this specific problem that we have with people and no critical thinking and misinformation and disinformation and the entertainment of what conspiracy theories bring, the only way we're going to do that is by finding a way to write books the way that you wrote that book. And that is to get a person to engage, to enjoy it, and to then take something from it that benefits society.
Well, that's very kind of you. It's gratifying. I took up writing late in life. I retired around 2015, and by 2017, I realized I was never going to be able to play golf well. So I didn't drop it, but I play socially, but that's about it. And, having homes in both Massachusetts and Florida, got a lot of different conversations from different points of view. And I thought, well, maybe I enjoyed writing when I was a kid, and I was in a high school newspaper. and had a particularly good faculty advisor who made it a big impression. So,
Yeah.
as you kind of comment. And so I thought I'd take a cut at writing, and my first book was a presidential history, 3.5 years, but I just took it a day at a time. I love getting up in the morning at 5 o'clock, making coffee, kind of reading the news, and by 7 o'clock, 7:30, I'm kind of writing away until early afternoon. Then I take the day off, and there was a nice rhythm I had.
Mm.
It kind of gave me a purpose. And the other thing I like about writing is, I had a good, successful business career over 40 years. That's all gone. That's kind of, well, the companies are still there. The people, of course, are there, and they have memories. But it's not something you can hold in your hand. But a book,
Mm-hmm.
I mean, this is 2.5 years of work. I can hold this in
Yeah.
my hand. It's a legacy. My kids and grandkids can see it, and that's very satisfying. And I consider myself lucky that I enjoy doing that. So because I enjoy doing it, I'm motivated to do it, and it gets done.
Nice.
But you just do the best you can as you get older.
The way that you made the book so that way, like you said, you can spend 30 minutes, 45 minutes after dinner with a glass of wine, reading it and ingesting this information. It feels healthy to do it in that manner.
Many presidential biographies have no illustrations, no pictures. It's just
Yep.
dense text for
Yep.
600 pages. I tried to break things up. I have like when we talked about I think alternative facts had opened up with the carbolic ball, where people would spray
Yeah.
carbolic acid up their nose
Yep.
during the 1892. So there was all kinds of crazy things floating around way before COVID, and I tried to illustrate that with back during Victorian times.
Mm-hmm.
So
Yeah, you did a good job of mixing together the interesting facts, the charts with the information, the anecdotes, like all together. Like you said, it's a symphony. It really is. It's a great book. Well, why don't you tell people where to find the book?
Well, you can find it at pretty much any bookstore. If they don't have it, they can order it and get it in a few days because it's available through the major distributor that they buy books from. And of course, you can get it online at pretty much anywhere. Obviously, Amazon, Apple, Barnes and Noble. Google will have it shortly. I checked a couple of days ago. That's not online with Google yet, but it will be very shortly. So almost anywhere. And so you look up COVID Wars by Ronald Gruner, COVID Wars by Ronald Gruner, and you'll have it either at the bookstore or in a few days.
Awesome.
So if you do read it and enjoy reading it, I'd be very happy to hear that. Post a review or whatever you'd like to do. So
okay.
good luck
Yeah.
if you decide to go with it.
Post a review. That's the most important part. Don't forget to support people. That's I keep saying this to everybody that comes on here. There's not enough good things I can say about people like yourself writing these books because I genuinely believe that we are at a point in our society where if people stop doing what you're doing, if I've had David Lipsky on here, I've had Clay Risens, I've had Jeffrey Boutwell, I've had people that have worked in the Nixon administration, the Obama administration, the Clinton administration. I had a guy who's written nothing but books on Mitch McConnell. But yeah, Irish
Okay.
Shapiro. And if it wasn't for the work that you guys do, I generally believe that our society would devolve. And I don't know. Do you know who Curtis Yarvin is?
No, I can't say I do.
That's
I'll have to
probably
look him up.
it's either a good thing or a bad thing. It's he believes that America should be a dictatorship. He's
I've certainly heard that theory. And
yeah,
I may have read his. I don't recognize the name.
yeah.
Well, a benign dictatorship is the most efficient form of government. You learn that, and you learn that in political science when you study that in junior high or high school.
Mhm.
But that only works if you've got a benign dictator, which doesn't last very long. They don't stay benign long.
Yeah, and in most of the interviews that he's had, that's generally where he ends up in a real bad place. But one of the things he believes is that Americans would be completely happy going home, strapping on a virtual reality headset, and then not doing anything else, just working and doing that. And that's personally not what I want not for me, not for my children, not for your children, not for society. And I think that you guys, you authors, the people that write these books, are actually fighting a fight against that by keeping people engaged, by writing good books that are interesting and bring good information. So I just wanted to say thank you.
Well, he's got a pretty cynical view, and you might suggest next time you talk to him, you might kind of seek out some different friends because, I know there's people that will immerse themselves in an artificial virtual world. I mean, but we had the same problem back in the 50s when people got glued to the TV sets, and we had dinner with TV trays. Dinner on TV trays.
Yeah,
I mean, that was crazy back then, and so it's not all that much different.
Yeah. Well, he's Peter Thiel's house philosopher is what he's called.
Okay.
He is there's if to not get too deep into this, as this is a more political conversation, but people believe that what you see right now with Elon Musk is actually part of Curtis Yarvin's plan, as he wrote on April 7th, 2022 in his Substack, Revolutionary Butterfly is the article on his Substack Gray Mirror. Donald Trump will not be the president of the United States. Donald Trump will hire a CEO that will run the country, while Donald Trump is a president that signs executive orders and gives speeches and goes to events. And it's really prescient, unfortunately.
So he wrote that 3 years ago?
3 years ago, yeah. It's if you ever want to look at in fact, I've got your email here. If you want, I can send you a link to it. It's very interesting.
Please do that. Just send me the name or the link or whatever I find it.
Yeah, I'll show it to you. I've tried to show a lot of people that, because as I myself don't want to be caught up in any type of conspiracy thinking, and as I tell my wife oftentimes, I'm very careful about saying, but if you connect this dot to this dot to this dot to this dot, so I like to put a little bit of a cushion between me and that by bringing other people into the conversation to get different points of view on whether or not that it's something that they see the same thing I see. But it is reading those two paragraphs for me was like, wow, this guy literally said what was going to happen today that is happening today, and I thought that was pretty crazy.
Very, very interesting.
Yeah, yes. I'll send it to you. Well, I don't want to keep you on here destroying your voice. I really appreciate the conversation. Thank you so much for coming on the show. Thanks for watching. If you like this video, please like and subscribe and hit that notification bell, and check out that video on the screen now.